Hi everyone, welcome to another one of our Advanced Rheumatology and Arthritis Research Center forums. Today's forum is on open enrollment for insurance for 2021. As you know, I'm Christine Matelan, Practice Administrator and Certified Research Coordinator for the practice. And with me today is Daniel Maxwell. And Dan, would you like to introduce yourself to our patients?
Yeah, thanks for having me here today. Like you said, my name is Dan Maxwell. I work for an insurance brokerage called OneDigital. We're right here located in Wexford. I've been in the business for about 5 years now, specifically on the individual, small market, and then the Medicare field. So very excited to talk about this today. I know everybody's getting ramped up for open enrollment, as are we, and we're just getting ready to go.
Okay, so first, we're going to be talking today about the history of Medicare, the national and state-specific laws for the year 2021, the differences between Medicare Part A, Part B, Part C, D, and your optional medical supplements, what to do 6 months before you turn 65, and finally your enrollment checklist. But before I start to give Dan a little brain test here, when does open enrollment begin and end?
Okay, so open enrollment is going to be from October 15th through December 7th. So during that enrollment time, you can enroll for the first time. You can make any plan changes that you want. You can review all your options. If you don't want to make any changes, during that time, you don't have to do anything.
So tell us a little bit about the history of Medicare. When did it start and how did it start?
Yeah, so a lot of people think Medicare is just some ancient process that we've had for years and years and years, but it's actually not as old as a lot of people think. So Medicare was signed into law in 1965. There's been some changes to it throughout the years. Some of the big changes, one specifically in 1997, where they enacted Medicare Advantage plans, which were kind of the end-all be-all, a one-stop shop for Medicare Part A, Part B, and your prescription plans.
Yeah.
We can get into that a little later. I don't want to take up our history time here, but some of the other things that have changed, in 2003, the prescription drugs came into play, that being that you have to go out and pick up your own prescription drug plan on top of your Medicare Part A and Part B, or else you can be penalized.
Oh, okay.
So that penalty is something that I think we want to dive into whenever we get to some of the new laws. But if you're without that prescription drug plan for 63 consistent days, you can be penalized for each day that you are not under that plan.
Okay.
So everybody thinks, oh, I have to go out and get my Part A, I have to get my Part B, and then they think that's all they have to do. If they don't have that prescription drug coverage, they can run into trouble. And whenever they do go to enroll in that prescription drug plan, their costs are going to be increased because they are going to have that late enrollment penalty.
What does Medicare Part A cover? Because everyone automatically, when they turn 65, gets that Part A card, correct?
Correct. So you can opt out of that, but Medicare Part A is something that you've been paying into your whole life. If you ever look at a paycheck and you see that Medicare line, all those funds are going towards funding that Medicare Part A. Part A is going to cover pretty much anything inpatient. So if you go into the hospital, you're going to a skilled nursing facility, you're going into an inpatient mental health, that's where your Medicare Part A is going to come into play there. Okay. There is a deductible. It is going to be a fairly high deductible, and there's no limit to how much Part A can charge you. So that's where the supplements come into, and I think, again, I'm jumping ahead a little bit, but that's just something to talk to an advisor or your doctor.
Someone gets admitted to the hospital and they need to have surgery. The hospital is going to bill their Medicare Part A.
Correct. Okay. So if it's an inpatient hospital stay, it's going to go to their Part A deductible.
Okay. What about Part B?
So Part B is going to cover what's considered your outpatient services. So going to the doctors, going to a specialist, physical therapy, getting an outpatient surgery, those things along those lines are what's going to be into your Part B. So one thing to kind of think of, A is inpatient, B is outpatient.
Okay. And there's also a deductible for Part B.
Correct. So that deductible is not going up this year. It's at $198.
Okay.
Yeah.
All right. What about Part C?
So Part C comes into play to cover everything that your Part A and your Part B isn't covering. So there's two different forms of this Part C, and I think I've touched on both of them a little bit already. We'll start with Medicare Advantage. So Medicare Advantage is going to take place of your Part A and your Part B, and you're going to have a specific copay for just about every service that you go and do. You go to the doctors, you'll have a copay. You go into the hospital, emergency room, skilled nursing, there's specific copays built into all those. Another thing with the Medicare Advantage plans, you are going to have additional benefits. So your prescription drugs are going to be built into that. So each carrier is going to have their specific formulary, their different tiers and a different cost for that. You don't need to go out and get a prescription drug plan on top of that. You also get a fitness benefit, usually silver sneakers, or something along those lines. You get dental, you get vision, and you get hearing. Okay. So there's a lot more kind of robust benefits in these plans.
And that is Part C.
That's Part C, and that's the Medicare Advantage side of Part C.
Okay, so you're able to help our patients decide which Part C plan they should choose.
Correct.
Based on their health and their current medications.
Correct.
Okay.
Yeah. So that's something that whenever we're looking to enroll someone into, it's on our checklist. And I think that's something we are going to go over. But it's what prescriptions are you on? What's your utilization? What are your doctors? Where do they practice? Yada, yada, yada. Okay. We go through all of that stuff to make sure that you are making an extremely educated decision, because there is, and I think where a lot of people get scared, there is something called a guarantee issue into a Medigap or a Medicare supplement plan, that if you choose to go the Medicare Advantage route, once you become eligible for Medicare, you are going to lose that guarantee issue into your Medigap plan. So that's something we want to make sure that if you do that, you're going to be able to make that change one way or the other down the road and inform them that they could run into issues if something were to come up.
So the Medicare Part D, is that an Advantage plan?
No. So that is going to be your prescription drug plan. You might often hear them called a PDP, which stands for your prescription drug plan. These are plans that you can either get through your Medicare Advantage plan. That's going to be built in. You don't have to do anything additional there. Or if you go the supplement route, or if you stay with original Medicare, you can go out to a private company and enroll in one of these plans. So these plans work a little differently than how your prescription plan works on your under 65 plan. So these have 4 different stages. So stage 1, depending on the plan, you are going to have a deductible that you need to meet. So that's going to be anywhere between $0 and $445. Okay. That went up $10 from last year, where it was at $435. So during this stage, depending on the plan you select, you could be out of pocket for your prescription costs until you reach that. So if you have a prescription that costs $50, you haven't met your deductible yet, you're likely on the hook for that $50. After you meet your deductible, that's when you get into your specific copays. So each plan, they're going to have 5 different tiers of copay cost. Okay. Tier 1 are going to be your preferred generic. Tier 2, non-preferred generic. Tier 3, preferred brand name. Tier 4, non-preferred brand name. And then that 5th tier is going to be any specialty drug. Okay. So there's, depending on which carrier you go with, which plan you select, there's different copays for those. But one way to think of it is Tier 1 is going to be your most affordable. Tier 5 is going to be your most expensive. Okay. And then it kind of climbs up to get to that Tier 5.
Okay. Now, what about supplemental plans?
Yeah, so this will be called a Medigap. Okay. So not to confuse everybody, I know we've thrown a lot of letters out already. Yes. Medigap plans are named based on a letter. So it's A through N. And each plan has a different kind of cost sharing that they go with. I think we've brought it up already, but if you are Medicare eligible after January 1st of 2020, you cannot enroll into a Medicare supplement plan F as in Frank or Plan C as in Charlie. So these two plans covered both your deductibles, and with new laws that came into play, they got rid of those specific plans for anybody who is Medicare eligible after January 1st of 2020. Now, somebody who's Medicare eligible for December 1st, 2019, they still have the option to enroll in those plans, even if they didn't go on Medicare at that specific time. Okay. So if they just come off a group plan, they'll be in their initial enrollment period, which we'll get into a little bit later, but they would be able to enroll in that Plan F or Plan C if they wanted to there.
Okay. And then everyone talks about falling into the donut hole.
Yeah.
Where does that lie in our ABCD alphabet?
So that's going to be part of the Part D prescription plans. So as I was getting into, you have your deductible phase, you have your tier phase where you're paying no specific copays, and then you get into what's called the donut hole phase after that copays. So that number where you would hit that is going to be around $4,130 is where you would reach that donut hole. So you have your deductible, which is $445. You're going to spend that. Then you have your copays, and you might have all generic drugs, which could be a $0 to $10 copay. Right. So you think there's no way I'm going to be able to get to this $4,130. Right. But they do it a little differently, where the cost of the actual drug, so the retail cost, is going to be what goes towards meeting that $4,130. Okay. So if you have a $0 copay, the drug costs $50, you're going to have that $50, which goes towards meeting that $4,130. So once you get to that $4,130 and get into the donut hole, you pay 25% of that retail cost for your generics and for your brand names. So you can see, or if you've ever looked at what an actual cost of a prescription is, that can get fairly expensive.
Especially in our line of medicine.
Exactly. Yes. So that's why they came up with what's called a catastrophic coverage. So at $6,550, that's whenever you get into the catastrophic phase. And on that one, you're either paying $3.95, $8.95, or you're paying 5% of whatever the actual drug cost is. And it's going to be whichever one is more.
Okay. So 6 months before turning 65, what would our enrollment checklist be?
Yeah, so I think the first thing that you want to do is check to make sure that you are eligible to enroll. So some things that will make you eligible is if you are turning 65, that's going to make you eligible. If you're on a group plan right now, you are over 65, and this is going to be an employer-sponsored plan, and you want to make the switch to Medicare, or you want to look into Medicare, coming off of that employer-sponsored plan is going to give you what's called a special enrollment period, which will make you eligible for Medicare after you come off that plan. So first thing would be to make sure that you are eligible and when you are going to be eligible to enroll. Second thing is just to ask questions. One thing that a lot of people do is they'll go to their friends that are already on Medicare, they'll go to an advisor, they'll go to their doctor and find out, like, hey, is this worth it for me? What do you think my costs are going to be? We have a similar medical history. Can you tell me what you like about Medicare, what you dislike about it, and then get their opinion on that? And then always, obviously, talking to an advisor and finding out every single plan that is available. I'm sure we see a lot of commercials for all these different plans, correct, and it can get very confusing. 6 months prior to your 65th birthday, you probably need to get a new mailbox because you are getting a ton of Medicare mail coming to you. So just being able to make an informed decision and asking a trusted advisor or friends and family who have gone through this process to help you out is something that I would definitely recommend doing. And then 3 months prior to your 65th birthday, you're going to be in what's called your initial enrollment period. So the first 3 months you spent gathering all your information, finding out what to do, asking your friends. 3 months prior, you can actually go out and enroll in your Medicare Part B, which is something that you do have to opt into because it is an optional benefit. Reasons you wouldn't opt into Medicare Part B is if you are on an employer-sponsored plan, they have more than 20 employees, that is going to be your primary insurance. So if you're on an employer-sponsored plan and you have under 20 employees on that plan, Medicare is still going to be your primary. So you would want to go ahead
even
and...
if you continue to work,
Correct.
you still have to get Medicare Part B.
If you are under the 20 employee threshold, yes. So if you have that under 20 employees and say you go to the doctors and you don't have your Medicare Part B, they're likely going to deny that claim even though you do have the insurance through your employer-sponsored plan. So that's something to always check. Whether you have HR, you have a brokerage that you're working for, it's always good to reach out to them and make sure you know what you're doing and what you need to do if you're kind of on the brink of, am I over 20, am I under 20,
Right.
to find out how that's going to work for you.
Because people seem to be working longer
Mm-hmm.
now. Okay, so say you're a fairly healthy 65-year-old individual. You're on some generic blood pressure medication, and then unfortunately you suffer a heart attack, and your cholesterol's through the roof. And now you've got to go on one of these new expensive injectable cholesterol meds, and you're already enrolled in one of our local Western Pennsylvania Advantage plans.
Okay.
Can you switch back and say, you know what, now I really think I need Medicare Part B with my supplement because I'll get better coverage on my medicine that way?
Okay, so switching from a Medicare Advantage plan to a Medigap plan.
Yes.
So if you go with that Advantage plan right off the bat, once you turn 65, you do lose that guarantee issue into the supplemental plan. So you are going to have to go through a series of medical questionnaires to get into that supplemental plan. Are you going to get denied into the plan? Probably not.
Okay.
Will you get a different price than if you were to go into that plan with a guaranteed issue? Probably. It's going to be based carrier to carrier. You can try with one, they can say no. You can try with another, and they might be a little bit more lenient depending on kind of everything that's going on. But if you do run into that issue, definitely talk to your advisor about that and pick their mind. And then maybe talk to the carrier and figure out what you can do there. It is going to be a significant difference in pricing.
Right.
So there's always not loopholes, but all the carriers want you to have the best. So they're all going to do whatever they can to help you out to the best of their ability.
But no type of government penalty or anything like that.
Nope. You just lose the guarantee issue,
And so
which if you call that a penalty, yeah.
Every year you can check your car insurance and switch from carrier A to carrier B. But when it comes time for Medicare and picking a plan, every year you can't be switching back and forth.
So during the open enrollment or the annual enrollment period, which is at October 15th, October 15th through December 7th, you can make a plan change.
Okay.
So let's say you're with X local carrier, you get a new doctor or a new specialist that doesn't accept X insurance, you can go out and make a switch to Y insurance so that doctor is going to be in your network. So you're paying the least amount to see that specific doctor.
Okay.
So you can make that change during the annual enrollment period each year if you see fit. If one formulary isn't covering every prescription that you are now on throughout the whole year, you can make a change to a different carrier for that reason as well. So that's something, again, you would want to look into with your advisor or whoever you are getting your Medicare advice from, and make that change if it's necessary.
Okay, so if you choose an Advantage plan, you automatically have Medicare Part A. Does the Part B go away?
No, so you are still going to have to pay your Part B premium. Yeah.
Okay, and then people get confused about which card to give to their healthcare provider for billing for an office visit or, an injection or blood work or whatever it may be. So
We always recommend carrying every card that you have. So that's going to be your red, white, and blue Medicare card, which would have your Part A and your Part B effective date on there. And then carrying whichever supplemental route that you take, carrying that card along with you. Usually the doctor's office will know which one they want to take, but some doctor's offices have to bill the Medicare side, the original Medicare side, and then the supplemental. So there's times where they're going to need both of those cards. So if it's not a burden, carry both. If it is a burden, I would just carry the supplemental card.
Okay, and then sometimes you actually have a pharmacy card too.
Correct, yeah.
Okay, so we're going to make sure that they ask important questions, and make sure that whatever plan they choose, the hospital and healthcare providers are in that network.
Correct.
You always want to make sure that you check with the plan to make sure your doctor is in network. What if someone travels to another state? Is Medicare universal throughout the United States?
Yeah, so the Medicare supplement plans, that's going to be that plan A through N. Those plans are going to be accepted wherever Medicare is accepted.
Okay.
So there's really no network there that they have to worry about. The Medicare Advantage plans don't travel as great. It's really going to be dependent on the carrier that you select. If you select, for example, something that's Western PA specific, and you go down to Florida,
Right.
You might run into some issues. If you're going to Maryland, if you're going to California, there could be issues. That's something you would want to check, especially if you have a vacation home, you're spending multiple time in these southern or western states during the harsh Pennsylvania
Right.
winters. That's something you want to check on. One thing also to kind of make note of, every emergency room across the country is going to be considered in network.
Okay.
So whether you have a local carrier, you have one of the national carriers, if you go outside the state and, for example, you break your ankle, you don't have to trek all the way back to Western PA to go to the emergency room. You can go to the closest one.
Okay. And obviously, you want to evaluate what medications you're on right now with your healthcare provider and where your condition is, because you may have to switch from something that is a tier 1 to a tier 5. And you explain, most people would think that tier 1 is, your Jaguar, and your tier 5 is your Kia. But it's the opposite when it comes to prescription formulary.
Correct.
plans.
Yeah.
Okay. And speaking of formularies, you want to make sure that your current drugs are on that plan's formulary.
Correct.
And the pharmacy, because if you go with an Advantage plan, certain Advantage plans have certain specialty pharmacies that you have to get certain specialty drugs through. If you like getting your drugs through the mail, you need to check and see if that is a possibility. Check the rating of the insurance carrier, either through friends and family, like you said, or a broker.
Correct.
Understand all your enrollment options. And no question is too big or too small. Plan to enroll on time to avoid penalties and delays in coverage. And if you plan to enroll in your initial enrollment period, set a reminder 3 months before your 65th birthday, as you said. And calculate your costs. Make sure that it's going to fit into your budget, along with those premiums, the deductibles, the co-pays, and the co-insurance. And you want to make sure you get confirmation and receipt of your Medicare card. Up until last year, your Medicare card had your Social Security number on it, and then they changed those all to capital letters and numbers for more HIPAA and privacy
and security
concerns.
reasons, correct.
Yes. Well, we've come to the end of another one of our Advanced Rheumatology forums. Today we were discussing Open Enrollment with our friend Dan Maxwell. Open Enrollment begins in October on the 15th and ends in December on the 7th. So you have some time to start making some choices or start thinking about choices. And if you would like to have a consultation with Dan, you can reach him by contacting us at info@advancedrheumatology.net, or you can reach out to him personally at...
Yeah, it's going to be D as in Dan Maxwell, Maxwell at one, spelled out ONE, digital.com. Again, dmaxwell at OneDigital.com.
Okay. Thank you so much, Dan.
Yeah.
I mean, I learned quite a bit today, and hopefully our audience did as well. And again, stay tuned for our next weekly Advanced Rheumatology Forum. Signing off. Thank you for watching. Remember to subscribe to our YouTube channel and tick the notification button for when new videos and forums are posted. You can also visit us on Facebook at Advanced Rheumatology. Thank you and see you again.